Hello, everyone, and thank you for joining us for our latest Ask the Mito Doc webcast. Tonight's topic is getting physical for the fall and winter months. Tonight, we will hear from two great panelists. Dr. Ava Morava-Kosiks from the Mayo Clinic in Rochester, Minnesota, is actively involved in developing novel therapies and genetic disorders. And joining from South Carolina is Jennifer Poirier, who is a licensed physical therapist with Chit Chat Therapy in Fort Mills. Of course, both of our panelists work with mitochondrial patients within our community. Our very own Margaret Moore will be our moderator this evening. Our Ask the Mito Doc webcasts are made possible through the generosity of these sponsors, so we ask that you join us in thanking them for their support. Thank you, Edith Trees Charitable Trust, Akron Children's Hospital, PTC Therapeutics, and the Jack Edwards Family Impact Fund. We want to direct you to our coronavirus resource webpage for updates, specifically about the distribution of the vaccines and the impact on our patient community. Past webcasts focused on COVID are posted here as well. Visit www.umdf.org/coronavirus. Every month, UMDF provides an important resource, virtual support meetings. We invite you to scan here or visit the UMDF calendar for upcoming meetings. Join from the comfort of your own home for virtual support. Also, make sure you check out MitoU. This is a great resource for patient families and our scientific and medical community. It provides you with helpful information on diagnosis, treatments, and will be continually updated with informational videos for your viewing, including the archives of these Ask the Mito Doc webcasts. We are excited about Mitochondrial Medicine 2022, live in Phoenix, Arizona. Take a look at your calendar and save the dates, because we would really love for you to join us in Phoenix in June. We know you're seeking answers, and UMDF is always here to educate in difficult times and provide helpful resources and offer caring support. We can connect you with our patient concierge, or you can contact our support line at 888-900-6486, and our patient concierge representative will connect you with a local Mito family or a UMDF support ambassador from our national network of volunteers. Before we hear from our panel, we have some housekeeping items for you. For viewing this webcast, it is best to select side-by-side mode for better view of the slide and the speaker. We have muted the line, so if during this webcast you have a question, please use the Q&A button to type in your question so that we can get answers for you. We ask that you keep your questions focused on the topic of this webcast. Also, please note that closed captioning is available, so if you would like to turn the live transcription on or off, this is the location at the bottom of your bar that you would do that. And as always, if you are having technical issues, please raise your hand and a UMTF staff will assist you through the chat function. Looking ahead, next month, we will have a special end of the year Ask the Mito Doc. Join us and 8 Mito clinicians from across the US and Canada. No presentations, just Q&A. Watch your email and social media for ways to register and to submit your questions. Now it's time to get started, and Margaret Moore, our moderator this evening, will get us started with our first speaker. Margaret?
Hi, everyone. Welcome to our November installment of Ask the Mito Doc webcast. We're excited about our topic tonight. Let's get physical in the fall and winter months. We will have multiple speakers tonight, and we'll be holding our questions until the end. Go ahead and submit your question in the Q&A portion of at the bottom of your screen. But if your question doesn't get answered this evening, please know that we will seek to get them answered after the meeting. Some questions are not able to be answered in this forum. I want to get started by thanking our speakers for taking time out of their busy schedules to be with us tonight. And we have a surprise guest. I'd like to introduce Tomas Koziks, who is a physician researcher at the Mayo Clinic. Tomas, you want to tell us a little bit about yourself?
Yes, so I'm working here at Mayo Clinic, and I'm really interested in mitochondrial diseases, and we do some translational research to understand, the significance of the mitochondrial function or dysfunction, if you will, in disease and health. And when Eva told me about this webinar or Ask the Doc section, I got very excited, and she told me that I might be able to say a few things about, mitochondria and exercise. So I'm sort of a party crasher here, but I hope that you will actually enjoy the first few slides I would like to show you about mitochondria and the exercise.
Well, we are very happy that you crashed our party tonight. And without further ado, let's launch into your presentation.
Thank you so much. So I think that everyone realizes that, and this is not just for mitochondrial disease or actually dysfunctional mitochondria. I think it can also be true for healthy mitochondria, that if you have too much and too rapid exercise, that is really stressful, and it could be harmful and could affect health, and especially the mitochondria. But also if you have too little exercise, the activity is also not, this kind of inactivity can also not be healthy. So it's maybe with everything, you have to find that sort of, golden middle. And this is what I would like to just show a few examples, how it really works with the mitochondria. And if I can have the next slide. So basically, this is what happening. So if you start some light training or even some moderate training, what you can see that the mitochondria, they become sort of like healthier. They will produce more ATP to meet the demand. They enhance their respiratory capacity. But you can already see at the moderate exercise, they already start sweating, so it might be somewhat difficult for them to keep up with the increasing exercise load. And the next slide will show you that if you further increase that exercise, then you can see that mitochondria maybe even become dysfunctional. So that very intense or very excessive training will lead to declined mitochondrial function. Next slide. And also what we see in literature, and what we actually can find when you have this exercise training, that the reduced, that also paradoxically reduces reactive oxygen species production. And the next slide will show you another point, that you have a completely altered protein homeostasis, and also you have a large amount of proteins which are damaged, accumulated. And in the next slide, we will also basically conclude from these data that mitochondria in an excessive training will show a compensatory shutdown. So the mitochondrial function or the complex activities will be downregulated. And we think that this might be something, important to prevent further damage to the mitochondria, further accumulation of these damaged proteins, and especially the further accumulation of the reactive oxygen species. So you have to be careful with that part, this excessive exercise. And if we can move to the next slide. But what we also see that if you have this excessive exercise, and after that you have a sufficient recovery time, so you give mitochondria sufficient time after training, then mitochondria will quickly regain normal functional capacity. These protein modifications or damaged proteins will be sort of, removed, and new proteins will be made, which are again fully functional. So the initial dysfunction of these mitochondria, or as I said, sort of, protective shutdown of the mitochondria will be completely reversed. And the next slide. And that is also something very important, to find that optimum amount of recovery, which will be sufficient, for this improved mitochondrial function. And the next slide, maybe at the very end. So I think this is what we need to really think about. And I think in Eva's talk, it's going to be also very clear at the end that this is still maybe the 100 million or maybe the $1 million question. So what is that optimum to actually increase exercise, especially in an individual with a mitochondrial dysfunction? So how far we can push these mitochondria, that this sort of protective shutdown of the oxidative phosphorylation and the complex enzyme activities is still becoming sort of adaptive or protective. And the other very important question, once we find that optimal level of initial exercise training and the intensity of the exercise, how much recovery period we will need to really build into this scheme. So I think we don't have the answers yet because this is a very interesting and intriguing field of research. But these things we have to really keep in mind, that it's very important to find the exact amount of exercise, which is not really damaging for our mitochondria, and also the exact amount of recovery after that kind of, reaching that almost limit exercise level, and then providing sufficient time for our mitochondria to recover. And most of the time they recover at somewhat better level. So basically, slowly you might be able to build up some sort of improved mitochondrial function, and that could be really beneficial for individuals with a mitochondrial dysfunction. So this was what I wanted to just say about the exercise and the mitochondria and what we know about the physiology around that aspect. And this presentation or these mitochondria were mostly healthy, but I think we can very confidently assume that somewhat similar processes will also happen in a diseased mitochondria. And I just, with this, I would like to give the word back to Margaret. Thank you.
Oh, thank you so much, Dr. Kozics. That is super interesting that we know we all have mitochondria, and we know that they all get tired. And it's, I think, nice to start with a baseline and then talk about the way this, different activities might impact our patient population. So without further ado, I'd like to introduce Dr. Ava Morava, a geneticist from the Mayo Clinic, who is here today to talk to us. And Dr. Morava, do you want to tell us a little bit about how you and Tomas know each other?
That's an interesting question. We were college sweethearts, and 32 years later, we work together on mitochondrial disease. So that's a nice story, right?
Yes, it is. It is.
So may I start with a very basic introduction, you all know, but maybe it's good to repeat this for the scientific part of my talk, that even though mitochondria have their own mitochondrial DNA, there is very important regulatory function coming from the chromosomal DNA, which is very clearly affecting mitochondrial DNA function. And some of us have problems in the mitochondrial DNA, and some of us have problems in the chromosomal or nuclear DNA causing mitochondrial disease. And what I will present to you is mostly based on studies of patients who had different problems with their mitochondrial DNA. So the most evidence about exercise in the literature is about them having either deletions or point mutations in the mitochondrial DNA. May I have the next slide? And the next slide. So Thomas was talking about training and exercise, and this is a very busy slide, and I just want to show you two things on this one. So there are two different types of exercise, and we usually think about fitness training or aerobic training when we try to exercise in a way to avoid to increase the lactic acid levels in our body. We know how much that hurts, and even a healthy person would experience the same thing. If you don't let enough oxygen flow to your muscles because you're working so hard, lactic acid will increase, as you see on the left-hand side with the red arrows, burned from sugar, and you would make much less energy if you push your muscles that way. If you do resistance training, you will produce much more lactate. If you do endurance training, so fitness training or aerobic training, then you will be activating your fatty acid oxidation, and you will make actually more energy by the same metabolic pathway, using more fatty acid oxidation in your mitochondria. Next slide, please. So let me tell you about this series of experiments which were done actually already starting from 2001, 2004, and 2006 with small groups of individuals who had mtDNA, so mitochondrial DNA mutations. These people, and actually the first study was only in 10 patients, they got on an exercise bike, which was really designed for scientific measurements. And they had to bike 20 minutes, 3 times a week. They came together and they did the exercise together, which is always more fun than working out alone. And they did have a lot of measurements because everybody was afraid that doing this research might hurt our patients. So they did measurements like a phosphor MRS. I will show you what that is, but practically it's measuring in the muscle whether your creatinine and creatine gets phosphorylated, and it's a measure of how efficiently you can use and produce energy. They also measured how much oxygen you use and how much oxygen you can actually suck out from your blood, how much you can take up from what the air you breathe in and get into your blood. This was an invasive study. They actually did muscle biopsy before the research exercise training and after. So they did take a needle biopsy and measured enzymes in the muscle, oxphos enzymes. And they also checked whether the genetic mutation percentage will stay stable or get changed. Next slide, please. So 14 weeks of exercise training, the people came together 3 times a week. We're on their bicycle. So how do the scientists measure the actual consequences and the outcome? They use this Douglas bag, which is really funny. Actually, it's already used since the 1920s to collect air during exercise. So you can actually measure everything what's in that breath, right? And then they can see how much oxygen and CO2 and N2 you're producing. Next slide, please. So actually nowadays it looks like this. You're connected to this big bag and then they measure how well you burn calories and how much oxygen you produce while you're exercising. And it's also sort of correlating with your muscle oxidative phosphorylation or ATP production. They also check how much is the artery-venous oxygen difference, so how efficiently you take up the oxygen. Next slide. Yes. So I wanted to show you that you can actually measure your energy production in the muscle by an imaging technique. It's almost like a heat map. You can see like how active is that muscle and how much phosphorylation is happening in the muscle. Or you can also measure a peak and measure the phosphorylated creatine compared to the free or inorganic phosphor. And these are all very important measures at the end to say what happens to you when you exercise. Next slide, please. So then this very important final step when they took a biopsy, a needle biopsy before and after the exercise, and they looked for mitochondrial volume and that's actually the percentage of muscle fiber volume occupied by mitochondria. So it's really, it really matters if that amount increases, because with more mitochondria or larger mitochondria, you could produce more energy. And they also did muscle biopsy for staining and measurements, whether the oxidative phosphorylation complexes would improve. So as you see, it is actually quite impressive that these patients, just with 12 or 14 weeks of exercise, could increase their oxygen use. The percentage, how much oxygen they can take out from their blood, oxygen carried around, how much more efficiently they use that circulating oxygen to fuel their muscle. How many more mitochondria they could measure in a muscle biopsy. Like, just look at this data, 50% of increase in percentage of muscle fiber volume occupied by mitochondria. And even with this staining, they could show that complexes, especially complex 1 and 4, in those who had this deficiency, improved just with 14 weeks of aerobic exercise. Now, this was huge. The next slide, please. So here comes the most scary part. What happens to the mitochondrial DNA mutation? So it was very interesting, because what they saw, that actually there were new cells which appeared in a muscle biopsy with different mitochondria. And some cells had a lot of bad mitochondria, others had a lot of good mitochondria, and some had just a mixture of both. So exercise increased the total amount of mitochondria in the patients, and it increased the bad mitochondria as well. But because the total load of good mitochondria increased, even though the patients had more from the bad as well, they could still produce more energy. So that was very, very striking and very exciting. Next slide. So the conclusion is that aerobic endurance training, so not heavy weightlifting or exercising several hours a day, aerobic endurance training, fitness training, can increase mitochondrial mass, increase mitochondrial biogenesis, so the number of mitochondria, and increase muscle mitochondria enzyme activities and strength. They could also measure all these oxygen use improvements in addition to these strength and fitness improvements. Very interesting that these trials were followed by several other trials. So after this initial trial, another 8 individuals with mitochondrial deletions did the same study, and then others from other centers, they all found the same positive results. The latest exercise study, which was published, was with MELAS patients with a point mutation, very similar results. The studies also showed that when you stop exercise, actually your physiology goes back to where it has been. So you will lose the gain, what you had during the exercise. The next slide, please. So remember this, endurance training has been proven beneficial and safe in trials of patients with mitochondrial DNA mutations. This exercise triggers a lot of positive physiological mechanisms in your muscle, and your body will function better. Next slide, please. Right now, there is a consensus guideline, which was published, and we follow those guidelines. Dr. Parikh and Dr. Hirano both published on these recommendations. And what we recommend that a progressive endurance training with or without resistant exercise should be recommended to all mitochondrial patients. Now you ask me, where is the proof for patients with nuclear or chromosomal origin of mitochondrial disease? We don't really have much. We have some studies in different patients with different myopathies. A Dutch group was publishing there, and actually nobody reported any negative effect. How about resistant training? So weightlifting compared to endurance training, so resistant training, appears to have less beneficial effect. And strangely enough, aerobic exercise actually improves your function more compared to bodybuilding or resistant training. Should you start right away and jump on the bike for 20 minutes? No, we would like to emphasize that you should slowly increase the time of your exercise and avoid overtraining. Listen to your body. You will hear more about that during the next presentation. But you have to know that when you do cautious exercise, your body will adapt to these changes, and nobody really ever reported significant negative effects or injuries due to exercise training with mitochondrial disease. Next slide, please. So I just want to end with something, an additional note, which is only on not exercising. There is a horrible study which was actually done in patients with severe spinal damage who were unable to move their extremities and underwent muscle biopsy. Those individuals, totally healthy, within 3 months after the injury, had mitochondrial dysfunction in their muscle, measurable decrease of mitochondrial function. So obviously, we would like to advocate for activity. And now, thank you for your attention, and let's talk about what we should do.
Thank you, Dr. Morava. That was so interesting. I bet every single person that is listening today has the same feeling that I do, that you want to exercise right now because you can tell that it's good for you. So thank you so much. Such interesting information for our patients and really for anyone to know about the benefits of doing aerobic exercise. Next, I want to introduce Jen Hoyer from Rock Hill, South Carolina. She's a physical therapist. Jen, you want to tell us a little bit about yourself and launch into your presentation?
Sure. So I am a pediatric-based physical therapist, and I was introduced to a mitochondrial disease patient 12 or 13 years ago. And we had one really bad day coming into therapy before we even made it back into the therapy room, which kind of jump-started me on figuring out how to help these kids. And so that's what I've been working on. Okay, so if you can move to the next slide. Thank you so much. When you go to meet a physical therapist, the first thing that you're going to do, whether you're a kid or an adult or whoever, the PT is going to do an evaluation. And for us, what that does is give us a snapshot of what do you look like at 10 a.m. on Tuesday, you know, whatever day it is. So this is really interesting, and I'm glad to hear the previous presenters. One of the tests that I typically use for my mitochondrial disease patients is a 6-minute walk test. And what I'm looking for is to capture like a snapshot of what their endurance is on that given day, so that we can show to the insurance companies and, you know, to see improvements, data improvements as we're going along with our exercises. So one thing I want to note, these are just all standardized tests that you can do to measure like a snapshot of what they look like on day one. One thing that I highly recommend, if there are any therapists or any patients that are receiving therapy somewhere that is not with me, ask your therapist to monitor vital signs frequently throughout your session, because that's often what I use to tell me when we are getting to that too much period, as we're working up to getting to those 20 minutes. Okay, next slide, please. So after the patient is evaluated, then the patient and parent, or, you know, if they're an adult, then the patient and the therapist will come up with a plan. Okay, so now we know what you look like on day one. Let's make a plan to see how we can get you stronger. So right now we are living in this COVID world, and that really plays a big impact to all of us, but especially to our mitochondrial disease patients. So the first thing we want to consider is, where is the therapy going to be held at? Is it going to be clinic-based, home-based, or via telehealth? And there are pros and cons to each of those. You just have to do what is best for the team at any given moment. You also want to consider the season. So I am living in the South, and it is really, really hot here in the summertime. So oftentimes what I find is these patients do not do well going out and doing a lot of exercise in the summertime. So we typically see our gains through the fall, winter, spring, and then it comes summer, it's just kind of like hold steady. And again, exactly what Ava said, is our plan is to make improvements in strength and endurance without going too far over. And sometimes that means that we have to alter the frequency different times a year, or week to week, month to month basis to do what the patient needs at any given moment. Okay, next slide, please. So in a PT treatment, we're gonna be working on improving strength, improving their aerobic endurance, and we're also gonna be teaching a lot of things. So the best thing that I feel I can give any of my patients as a PT is to build them a toolbox. I term it that on day one, is I'm gonna throw a lot of stuff at you over our course of treatment here, however long that may be, and we're gonna just build you a toolbox so that you know what to do when you leave me. Sometimes, depending on the patient, we might recommend some kinds of equipment. That might mean, you know, a wheelchair for long distances, a walker, some sort of device for the bathroom, or whatever they need. It's just sometimes we need a little bit of extra support to conserve our energy for those mundane day-to-day tasks, so that we can use our energy towards positive things. We may recommend some kind of bracing. We're going to look at their mobility skills and make sure that they're functional with everything. And energy conservation for this population is really going to be your key to success. It's going to be improving strength and endurance, but while still knowing how to conserve our energy to still have to do life, right? We have to do our PT sessions or our exercise and also live the rest of our lives. Also, I do find a good bit of pain in this population, so that's often one of my goals too, is to minimize pain that they're experiencing on a day-to-day level. Okay, next slide, please. So energy conservation, right? That's what everybody wants to hear from me, is how can we conserve energy? We talked about before, down south in the summertime, it is hot. When it is hot at 6 o'clock at night, That is not when we are going out to do our walk, 20 minutes of walking in the neighborhood. We are going to do it at 7 o'clock in the morning before it gets too hot. And maybe we have to break it up and do it in a couple of different times throughout the day. So we're going to consider temperatures when we're planning activities. We're going to consider time of day. If we're trying to get that, you know, I've given you a home program to do, and you know, you kind of forgot about it until the end of the day. So you do it real fast and then go to bed. And then first thing the next morning is probably not the best time to do it again, right? We want to make sure that we're choosing ideal times of the day to be doing our exercise and planning activities. Stress. We know for these patients, stress plays a huge role in disease progression and these bouts of flare-ups. So I want to make sure that they're not feeling any additional stress other than the physical stress of doing the activity. I don't want them to be emotionally stressed. I don't want it to cause any increased anxiety. You know, it shouldn't be a stressful time of day to try and like, okay, hurry up, like we got to get here on time, we're running late. I don't want any of that to cause extra stress. So all of that should be considered when you're planning your activities. Hydration. Oftentimes when I am meeting a middle school or a high school kid, the first thing I'll do is I'll give them a chart so that they can track their fluid intake for the day. Because what I'm finding clinically observing is these patients tend to be chronically dehydrated, and that plays a big role on what they are able to do on any given day. And then we want to plan activities so that we can maximize energy conservation. If you are, you know, working on your training sessions, but you know, you're also trying to schedule a day at the amusement park, you know, probably best to not schedule them back to back. We want to just kind of think about our activities, plan out our activities to allow for that exercise, rest, exercise, rest, exercise, rest. And that's going to be different for every patient, and different for different times of the year. So it's really just about learning your body and progressing in a way that feels good and comfortable for you personally. Okay, next slide, please. So these are all types of exercise that we can cater to be a little bit more gentle. Yoga and Pilates I like for resistance training because they can be really modified to any ability level. So some of my patients that come to see me are walking, and none of them can start with 20 minutes of exercise, but we work up to that. But some of them are not able to walk or stand independently. And so we start on the floor and do what we can on the floor. We're going to do gentle strengthening, functional strengthening. You know, a gallon of milk is 8 pounds. So if you are an adult and you need to be unloading the groceries in your house, you need to be able to lift an 8-pound gallon of milk to put it in the refrigerator up to shoulder height. So gentle strengthening, but we want to make it functional. And then we're talking like the previous presenters, functional aerobic activity. So we want to get to that 20 minutes. That's the gold standard. That's typically my long-term goal for every patient that is able to walk into my doors, is that we can do 20 minutes of exercise consistently. But oftentimes we're starting with 30 seconds, not on a treadmill, not on a bike, 30 seconds of moving. And then we stop and take our vitals and assess how do we feel. So we're going to make it functional so that we can get to that 20 minutes of loop around the neighborhood, or 20 minutes of walking through Walmart, right? Because that is the big store. And oftentimes we forget about how taxing those type of things are when we're planning our activities for the week. Okay, next slide, please. So some patients that come to me with mitochondrial disease also have decrease in muscle flexibility, and I'll often put them on a stretching program to work on loosening up those muscles. Motion is lotion, right? So it keeps our joints lubricated, and oftentimes will decrease our pain level, which will allow us to do more. Anytime you're doing any kind of stretching, you want to ensure that the muscles are warm. So that it's good after a shower, after a bath, or ideally It's after you've done your aerobic exercise for the day, after you've done your stationary bike or your elliptical or your treadmill or you're walking around the neighborhood. For an effective stretch, we know research tells us 30-second hold. And the goal is always pain relief. No stretch should hurt. And you want to make sure that you're using your proper form so that you're actually stretching the correct muscle. Next slide, please. Virtual PT has been an eye-opening experience for many of us in this field over the last almost 2 years. And I will tell you, this list has been approved by one of my telehealth teenagers. So I am not asking too much. And these may seem like simple, ridiculous things that I'm recommending, but there is a reason for each and every one of these. If you have chosen to go the telehealth route, this is how to make it the best that you can. Make sure that you have all of your supplies before you start the session. Make sure that your device is charged or plugged in, or both if you can. Turn the camera and the microphone on, because I can't tell if your form is correct if I'm looking at the floor. Set reminders for your appointments, because when we're home all day, oftentimes we forget what day it is, what time of day it is, what did we have to do today? Oh yeah, PT started 10 minutes ago. Minimize distractions and make sure that your household knows the timing of your appointments. I cannot tell you the crazy things that I have seen over the last 18, 20 months because, oh, we forgot it's 9 a.m. on Tuesday and so-and-so's in PT. Make sure that you're in a room that you can hear and quiet, and make sure that you can hear and see the therapist. It's usually like the first 30 seconds. Can you hear me? Can you see me? Okay, let's go. Next slide, please. Okay, so now that we know what PT can do, we need to figure out how to find one that will know what to do with you, right? My recommendation is to find a really good PM&R doc, physical medicine and rehabilitation physician. Really, I call them kind of the quarterback doctors. Like, they're going to be a great person to have on your team because they will help to coordinate everything. And if you can find a good one of those, then they know how to find a really good PT who knows what to do with these neuromuscular disorders. Local parent groups, local support groups. That's how I have found a lot, or how a lot of my patients have found me, is through networking in our local communities. And then once you do find someone, before you start and make a plan with them, make sure that they have experience with patients who have mitochondrial disease, and ask them like details about, what is your experience? Was it just one person 10 years ago, or do you see this consistently? And what are you seeing as an outcome? Are you seeing improvements? Are you figuring out a way to get these patients where we need them to be? Next slide, please. Okay, so a lot of you maybe don't need therapy, but you're motivated, you're wanting to exercise and start this, and you're kind of looking around your house like, okay, what do I have? I don't have a treadmill, I don't have a stationary bike. Like, let's see how we can accomplish this with what you have. A lot of common equipment that we have at home, you might have a yoga mat or an exercise ball, foam roller, resistance bands. If you don't have any of those, and you don't have the money to spend on any of those, cost-effective tools that will do the same thing are pool noodles, big and small, any regular ball, soup cans, gallon of water can be used as weights. Like we said, we don't want to overdo it with the resistance training, but functionally, we need to be able to do those functional day-to-day tasks. Okay, next slide. I feel like I just need to make this statement, put this out into the universe, that make sure that you are getting cleared by your physician before you start any exercise routine. Please, 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 please. And the PT if you have one too. Okay, I'm going to run through a couple of exercises with you, and then I'll teach you about how to progress them, make them harder and easier depending on your abilities. So next slide, please. This is called Quadruped. With my kids, we call it a table. This is kind of the basis for a lot of trunk strengthening exercises. Again, all of this is going to be done at a very, very, very slow progression. Okay, we're not going to jump into like 10 minutes of this tomorrow, right? We're going to start with 10 seconds and see, can you get in this position and hold it for 10 seconds? So what we're looking for here is to be able to increase your abdominal strength, right? So we're going to get in this position if we can and hold our abdominals tight while not holding our breath. And then if that's easy, then we can progress it by maybe lifting up an arm, putting it down, lifting up the other arm, putting it down. That's easy. You can try legs, one leg, the other leg. And if that's easy, then you can do one arm on the opposite leg, like a bird dog. This is all working on our core strength in the middle, okay? Next slide. Another great exercise for in your routine is a bridge. So we're gonna start with the picture on the left, laying flat on your back, knees bent, feet flat on the floor. You wanna make sure you're not up on your tippy toes, but your feet are nice and flat. And squeeze your tummy, squeeze your butt muscles, and lift your glutes off the table, lift your hips off the table. If that's all we can do is get up and get down, then that's great. Again, we are starting so slow. We don't want any of this to overtax. It's knowing our bodies. To make this one harder, we can hold it up there. Again, we are not holding our breath, we're breathing the whole time. Start with 5 seconds. That's easy, then try 10 seconds. If that's still easy, then while you're holding your hips up in the air, you can do little marches with your feet, okay? If you still want to increase that, then you can put something wiggly underneath your feet, like a pillow or you know, one of those air-filled Dynadiscs, a little exercise balance disc. Not bridge, that's going to be really good for your hip strength and your abdominal strength. Next slide, please. And then this is a sit to stand. Now I've picked these 3 exercises because they're really good for overall function. We want to be able to get to that ideal 20 minutes of aerobic activity, but we might not be able to get to that 20 minutes in standing if we don't have the trunk or hip strength to get us there. So we're going to start with these exercises to be able to get to that endpoint. So for a sit to stand, it's a really functional skill. We're up and down from chairs all day long if we have the ability to stand and walk. So we're going to start with feet hip width apart, flat on the floor, and you're going to lean over, nose over toes, squeeze your butt, and stand up nice and straight. Okay, again, we are not holding our breath, we are breathing. In order to progress this, we can, when we go to sit back down, not transfer our weight all the way, just tap and then go back up, and then we can progress that to little mini squats or real squats, which, you know, are going to just be a functional strength that we're going to use throughout our day-to-day, picking up something off the floor, you know, changing laundry, putting something in the dishwasher. Those are all functional ways that we're going to use these activities, this particular activity. So we just want to make sure that our bodies are strong enough to handle everything that we need to do in a day. Next slide, please. I'm often asked, you know, so you're doing PT, like what can we do with it? And chiropractic care, massage, occupational therapy, speech therapy are all wonderful complements to physical therapy. You just want to make sure that the practitioners are all on the same page, and you want to avoid starting like too many things at the same time, because then you're not sure what's working or what's not working. Just make sure that they're knowledgeable about the diagnosis. Next slide, please. This is a resource list that I personally use to get a lot of treatment materials. They have this, I'm a pediatric therapist, so this is mostly kid stuff, but the KT tape can work for everybody. That's a good pain relief or you know, support for muscles, and they have a wonderful YouTube channel. Next. That's all I've got for you today. So I'm going to hand it over to Margaret.
I am back, and thank you, Jen. That was very comprehensive, and also really gives, you know, I think the point that really, and I know this because I'm a pediatric therapist too, but the functional piece of making sure that the activities that you're doing have a purpose, that they're not, you know, it's not an activity that's just there. It is to, we're not doing it, be able to participate in life in a more, in a more robust way, and to have the energy to participate in all the good things that our families really want to do. We have a few more questions that I think we can get to before we run out of time, and I will get started with a question, a few questions that were asked before our talks tonight, and I think I'm going to put the information out to all of you to see if you have any input on this. As many of our families know, sometimes our patients have what is referred to as ptosis or droopy eyelids. And is there any kind of therapy, any type of treatment that might help that at all?
Nothing that I, as a PT, would know how to do. Sorry.
Yes, there is not really a good therapeutic exercise, because when the droopy eyelids get very tired, more exercise is not helping. Usually you should just close them. But the surgical correction is really very successful in most of the cases. And I have several patients who had surgery and recovered wonderful quickly and without really significant ptosis for several years. So I would probably recommend rest instead of exercise for the ptosis, but consider maybe plastic surgery if it's really bothering your vision.
And how about any other facial drooping? Are there any other techniques that you think might help with just overall facial weakness?
I would say if you're seeing facial weakness in the oral area, a good oral motor therapist can probably help you with some exercises there. And typically that'll be a speech therapist or an occupational therapist who's done further training in oral motor therapy is what, in the therapy world, that'll be what it's called.
Yes, and I was thinking also same thing would go for any swallowing therapy or any difficulty people would have with eating food. One of the other questions that came through the Q&A feature is modified exercise. Are there any specific Mito programs for adults? I mean, kind of what I was hearing today was that all of this is very tailored to the individual, and having a strong physical therapist on your team that's willing to work with your lifestyle, kind of what you're doing is the most important part. Is there anything you'd have to add to that?
No, that would be my best recommendation is, if you're wanting to start something and you do have some functional weakness and some decreased endurance and you can't just get right into that program, then start with a PT and then have them really make you a strong and detailed home program for when you can finish with the PT and transition to a home program.
So I just wanted to say that the person who posted that question has her own little exercise therapy protocol, and what she does 5 minutes exercises throughout the day and tries to move all the muscles and joints. I found it a very interesting approach, and I wanted to ask you, Jen, what you think about this, because I found it actually very creative.
Yeah, I think it's a great idea. And it's actually one of my patients right now, we're working to try and get up to that 20 minutes and they can't do it in a row, but they found that if they do like 2 minutes of treadmill training, like broken up throughout the day, then they can get to that goal. And so now we're working on trying to make it like 3 minutes at a time. And then, we'll do to 4 minutes. But yeah, I think it's great. You just got to start where you're at and keep going.
And I think that, many of our patients have come up with their own plan that works for them. I know one of our longstanding adults that is a part of the UMDF has, for years since I've known her, she does 10 minutes of Pilates every day and goes for a walk. And that seems to be the magic magic amount that she's able to maintain, stay strong, but doesn't end up hurting. One of the things that came up in the talk that I kind of wanted to see what you all were thinking about, and I think you said it, Jen, but I'm pretty sure that Dr. Morava has mentioned this in talks in the past, is the impact of stress on a person with mitochondrial disease in their body when they're trying to, go through physical therapy or get exercise. Can you both kind of give your take on that?
Sure. I'm in a clinical therapy role, right? So I've done what I know to do for research with this, which is lit reviews. I'd be interested to see your thoughts on it. But I see in a clinical model that when a child has a lot of stuff going on outside of therapy, whether it's stuff going on at school, or they had a fight with a sibling earlier, or they don't perform as well physically that day. And then, sometimes we take the first couple of minutes to just like get rid of all that stress so that we can focus on, here's what we're here to do. We got to just get rid of that. You have to get it out. You have to process it, because when you hold that stress in, it has a negative physical impact.
And what are your thoughts there? Oh, go ahead, Ava.
Yes, I just wanted to tell you that when I worked in Nijmegen in the Netherlands, we developed a personalized scoring system for our patients. And we said you have 20 points per day. And, everybody's different. So maybe you work or you're at home, maybe you cook, maybe you have to do any kind of activities which cost energy. Then try to keep that 20 points for that day, that you have some points left before you go to bed. And if you have to do something difficult, you go to a party because your son just got engaged, then probably you will use like 15 points on that day, and probably you cannot do much more on that day. But maybe you did something like a really energy consuming activity. Go and take a nap and try to nap for 2 hours, and you get some points back you could use later that day. And everybody should have that 20-point system worked out for herself. Just feel like, what is the energy amount you have for a certain day, and what is the energy consumption by different activities, work or carrying home some food, or playing with your children, or if you're a child, of course, go to school or do physical therapy, and measure that out and try to sort of, like a banker, try to spare some coins for the end of the day, and try to gain some coins with being mindful and do some rest in between. And that is actually a pretty good system. Just your doctor cannot help with it. You have to make it for yourself and try it for yourself how it works. So
I love that.
Yeah. And then Thomas is just talking to my ear that rest, you underestimate the importance of rest, because actually our mitochondria recover while we are sleeping. So think about that. Napping is totally recommended to everybody, not just if you have an energy depletion, but to everybody, because that's when your metabolism will get back to normal, and you start again.
Well, thank you so much, Dr. Morava. This has been a really interesting evening. It's time for us to wrap up, and I just want to again thank our speakers for spending this evening with us. And I also want to remind you all to register for next month's Ask the Mito Doc webcast, which is our no presentations, all Q&A with 8 doctors. That will be on December 14th at 7 p.m. Eastern time. For those of you that maybe weren't in attendance when we answered your question, we'll be emailing you those questions in the next couple of days. So again, thank you to all of our speakers and thank you to our attendees, and we'll see you next month.